Hey guys, how y'all doing today? We have a special show. How y'all doing? Hey, Dr. Clerge. Thank you
Hello,
for
hello.
Oops, wrong thing. And as always, thank you, Kay, for being here. How y'all doing today?
Doing
Hello,
good.
I'm great.
All right, you look
I'm
fabulous.
fantastic.
You're fantastic. Y'all both look so beachy and happy. And all that I got going on is my dog screaming in my ear about a whole bunch of nothing. But anyway, so here we are today. We are going to talk to Dr. Clerge. He is a amazing God man. He has his own chiropractic offices or practice rather. Not only one, but four of them, which I just find to be absolutely amazing to have solve one thing and expand it out. So either way, thank you so much, Dr. Clerge. How are you doing? Everything's fine. Yeah. We already went through that. So anyway, can you please? I know, right? Kay's like, okay, she's falling off. Hey, Bernie, how you doing today, Bernie? Thank you for coming. So, Bernie, if you have any questions, make sure and put it in the chat, or if you want to come up, let us know. But anyway, we talk about chiropractic medicine. And Dr. Clerge, please tell us what exactly is chiropractic medicine?
Okay, so basically, most people are familiar with your, internal medicine doctor or your medical doctor, but chiropractors, we basically focus on the musculoskeletal system. So to make it simpler, if you have, let's say you wake up and you have neck pain or back pain or joint pain, then you should more than likely go and see a chiropractor.
Okay.
Different things that we can do, we can adjust, meaning I manipulate. When you hear the cracking, most people call it crack, like when you crack your neck and your back, the proper term is adjustment. So we can adjust the neck, the back, we can do physiotherapy, we can, get some imaging done, like for example, x-rays, MRIs, exercises, and so forth. So that's what basically that's what chiropractors do basically, is focus on the musculoskeletal system.
Okay. So how do you get to become a chiropractor? Because I did not know, and a lot of people didn't know that is a doctoral program. You are a doctor of
Right.
chiropractic medicine. So what do you have to do? Like, what are your prerequisites or the courses you have to take, beforehand, and then you have to get into the school of chiropractic medicine, or how does that go about?
Okay, so most chiropractors, it takes anywhere from 7 to 8 years. Okay, so the majority of chiropractors, they have a bachelor's degree.
Okay.
So that's a 4-year degree. You go to undergrad, and typically, folks who want to go into the chiropractic field, they'll have some type of undergraduate degree in science, so biology, even physics or whatever.
Okay.
Once you get that 4-year degree, then you can apply to chiropractic school. Now, some schools you may be able to finish in 3.5 years. In other schools, it'll take about 4 years. So on average, between undergrad and chiropractic school is anywhere from 7 to 8 years.
Okay. So,
And I'm sorry, I had a
no,
question.
go ahead.
And to answer the other part of the question, what type of courses? So for the prerequisites, so before getting to chiropractic school, in undergrad, you want to take, all your science courses like biology, organic chemistry. Some people may take biochemistry. So there are prerequisites that you'll need in order to even gain acceptance into a chiropractic school.
Right. So it's not something where you can say, I want to be a chiropractor and you go to college and it's a sure thing. No, you have to do the prerequisites. You have to make a certain GPA. You have to apply to all of the different colleges, all the school of medicines to get into it. And well, hopefully to get into it. And then once you admit it, then you go through the program. So you do at least 4 years and you have to be good at science, right?
Right. I mean, you have to pass these courses. You have to have a decent GPA to be competitive,
Right. Very competitive.
Right. And then, once you're done with that portion, with the undergrad portion, then you can apply to chiropractic school, go through the process, of going to get an interview and so forth, and, submitting all your transcripts and so forth. And once you get acceptance, then you actually start chiropractic school. Now, chiropractic school, the first 2 years are going to be your basic sciences. So once again, biochemistry, histology, physiology, anatomy, x-ray, imaging, those type of things. And then after these basic sciences, then you go into clinical sciences. So that's when you actually start to see people. you're doing examinations, you're learning how to adjust, you're learning how to read x-rays and so forth. So the last 2 years are usually clinical in nature.
Okay. So yeah, so it's not exactly the easiest thing, but it's so worth it, you would think, or you would agree, right?
I completely agree. I mean, nothing that has to do with the human body really is easy.
Right, right.
Therapy is easy. Pharmacy is not. It's not a walk in the park. It's hard. So anything where we have to actually interact with people and either prescribe or treat people, it's not going to be easy. It's definitely hard.
Right. So what made you, because growing up, I never thought about chiropractic medicine at all. What about you, Kay? Have you ever thought about chiropractic medicine? It was
As
not.
far as going into it or what? I mean, I was going to a chiropractor when I was in high school,
Okay.
because I'd been in a number of accidents. So I've been to the same chiropractor until, let's see, I probably went to him on and off for about 3 or 4 years, because I was in a couple of bus accidents, a couple of car accidents, and got hit by a car while I was walking.
Right.
So I've definitely been to quite a few chiropractors, and as I stated earlier, first time I've seen a Black chiropractor in my entire life. So, and a male at that. So I am overly impressed here.
I know, just love it. Obviously, I just love it.
Can I also add that when you said that chemistry is a prerequisite, that kind of threw me off. How does chemistry go in line with chiropractic?
Well, that's usually the misconceptions. Like, for example, what you just said, you got involved into several car accidents, and you went to a chiropractor. So most people just associate chiropractor with car accidents. Now, chiropractors, they do help people who were involved in car accidents, because obviously that's injury to the musculoskeletal system. But, for example, even in my YouTube channel, I don't see car accident patients, not for that particular channel, right? It's people, I'm dealing with people who have pain. So back to your question, why do you even take chemistry, histology, biology? Well, you have to learn the whole system, because you still have to interact with other medical providers. See, so for example, sometimes you may say, you know what, I need you to get an MRI, or I need you to get some lab work or some blood work. So you have to know the different mechanisms. So you still, even though you're not prescribing or you're not dealing with that part, on a daily basis, you still have to have the knowledge, so you can say, you know what, you need to see a urologist, or you need to see an orthopedic doctor. So you have to have the knowledge to be able to interact with different providers, basically.
Okay. Now, chiropractor is able to prescribe?
Not in certain states. So in, let me make sure I'm getting it right. I believe in New Mexico, they can prescribe. In Switzerland, they can prescribe. But as far as the other states in the United States, they're still working on getting more prescriptive rights. But those two places, you can actually see people and they actually can prescribe.
Yeah, that's how it is with pharmacists. In certain states, we can prescribe. In most states, we cannot. And a lot of times with like the basis of like the chemistry.
Sorry about that. I have a schnauzer, and he
looked around for her dog.
He goes crazy when people deliver things to the house. Yeah.
I was like, do I have a third dog? That one sound different. I was all paranoid. But a lot of times they give you, because you never know what, like you said, what range you have to deal with when it comes to other healthcare professionals. And two, sometimes they just make you go through the extra junk to exercise your brain and expand your way of thinking. Like all of the calculus and stuff and the trig and, all that hardcore math and stuff. And, I guess we needed the chemistry. But, I don't think I needed the math, but I guess it kind of builds on each other as well. And it just kind of, make your brain just like expand. So whatever something pops off, you can think quickly because you already got the cycle of building in your head, building up concepts and stuff like that. So Bernie he's asking me, are mortar and pestle or pharma pots used in today's pharmaceuticals? So I guess he's talking about that grinding, pestle and mortar. Sometimes people even use it in the kitchen. I haven't used a pestle and mortar since I was a little girl. Woo! When I was a little tender little pharmacist. So we don't have that. I don't even think we have one in our pharmacy where I work at, to be honest with you. So no, we don't make stuff hardly anymore. And to be honest with you, now when we get a compound, we just send it to a compounding pharmacy because
That's what I was about to ask you.
Yeah, because I know we talked about that before. Yeah, we send it to go to a compounded pharmacy because now all of the state regulations, they want special hoods and vents and all that. And, all these retails, they ain't trying to pay that kind of money and get into all of that. So they have like compounded pharmacy. So answer is no, we really don't use that anymore.
But those would be used in a compound pharmacy.
Oh yeah, definitely in a compounded pharmacy. Oh yeah, that's a good question. Yeah. You still do as we say in pharmacy, we still do the bump and grind, but only compounded pharmacies do that. I don't do. They say pharmacists are the best bumper and grinders, but whatever. I think they talk about motor testers. Took the fun out of pharmacy. No, they really didn't because I hated compounded, so I kind of really love it. I hated it. But what made you become a chiropractor? I mean, because like I said, I never read like Kay. She's familiar with it. But that wasn't a part of my lifestyle at all. Of course, you go to the doctor, right. The medical doctor, and you go to a pharmacy. But I never was in that world where I had to go to a chiropractor. So how did you get into it? Like, what made you like, I'm gonna be a chiropractor one day?
Well, I was involved in a minor sports injury. I used to play soccer, and I got injured. Now I didn't have any fractures or anything like that, but I had difficulties with range of motion. So, for example, turning my head. I wasn't able to do that properly. So I went to see, medical doctor, orthopedic doctor, and that didn't really help. It was basically, here, take this med, take this relaxer and call it a day. And someone basically kind of referred us to a chiropractor, say, hey, you know what? Try this guy. And I didn't know what it was, and I tried it. And I think my treatment plan was probably about like maybe 2 or 3 weeks. And after 3 weeks of seeing the chiropractor, I had better range of motion. I was able to move better. So I saw significant improvement, in comparison to just going to the medical doctor and get medication. So then that person and that doctor basically he was my mentor, and I basically asked questions. Hey, this is cool. You cracked my neck and it wasn't painful, like. So I started, looking into it, getting information from him, and basically that was the beginning of the journey.
Oh, that's how my journey started. I just worked. I didn't want to work at Burger King because in our small town, all you can do is either work at a fast food joint. And for some reason, I was like, I don't want to do that because I'll get super fat because I'll eat all the food. So I decided to harass some extra drugs to work at the pharmacy, and I just kind of stuck with it. I guess that's a good thing, a bad thing. Yeah, so the same thing. And, they were my mentors. They the one that kept pushing me to go forward. So that's good. That's good that he was, I guess it was a man. Was it?
Yeah, he was but he was a white guy.
Right. But mine was too. Yeah. Because back in the day, it wasn't a lot of, mixing up, but now,
Right.
Yeah, but now it's you see a plenty of, now I wouldn't say plenty, but it's not as hard to find. Right. So how do y'all do that? How do y'all do all that neck twisting without breaking necks? And I even see y'all wear like a slingshot type thing on a neck.
The white strap.
How do you do that without? I mean, because the rate of injury from the practice, from your practice is not your practice per se, but just in general is very low.
It's very low. Yeah, it's very low. The thing is, it looks barbaric, especially like if you go on my YouTube channel, and especially my introductions, like the first 15 seconds is, So when you hear it or when you see it, it looks painful, but it's actually not.
My Vivid Life said, I love the wide strap.
I love the wide strap. Yeah,
that's what I was tripping on. My Vivid Life, did you have a wide strap before? Because that's what you call it. I messed up.
Probably had a wide strap adjustment. But we're trained to adjust. So it's not like, we just go and adjust people. I mean, it takes years to master the skill. And even after you're done, and even after school, you're still working on your craft. You're still working on mastering, the adjustment.
Right.
And when we're in school, we actually practice on each other. That's how we start.
So
the first the first few years, we're the patient. So, you know, we're partnering with, you know, the folks that we sit next to, and we're learning how to adjust the neck. We're learning how to adjust the back. We're learning the joints. So, you know, it's practice basically.
And so
Did you hurt anybody?
Exactly. What's the rate of
anybody? You know, it's really hard to hurt someone. You know, people think
all that cracking.
It's really hard. Like it takes
fully at that point. Yeah, it seems like there'll be a lot of mishaps going on.
It takes a tremendous amount of force, because I've had people say, "Oh man, you're gonna break somebody's neck." It takes a tremendous amount of force to break somebody's neck. Okay, now with that being said, you know, when I see a patient, there are contraindications you have to look out for, just like pharmacy, right? I mean, certain medications, you know, you don't interact them with each other, right?
Right.
So,
okay, got you.
Right. So if I see a patient and I'm taking a history and he says, you know, I have osteoporosis, you know, or, you know, I had cancer, you know, in this particular portion of my body, or certain things that, you know, I had a fusion, you know, a cervical fusion or lumbar fusion. So these are contraindications where, you know, in my brain, I'm like, okay, well, that person cannot be adjusted, because osteoporosis, your bones are a little bit brittle, you know, and when a high velocity adjustment, it may cause some issues. So most chiropractors are trained to detect, you know, contraindications. But besides that, you know, I've had that question all the time. Can you break somebody's neck? Not really. I mean, unless you apply a whole bunch of force, you know, it's
really, I mean, because it looked like there's a lot of force, and I mean, but is there a certain way you palm the neck, or I mean, because I mean, how you not breaking a neck?
Right. So basically, so to kind of explain it, so okay, so if I turn, let's say I turn my neck to the right, okay.
Okay.
At that point, there is that end range of motion, meaning that at that point, at that range, I can't really go any farther. Okay. So there's an end range of motion that we get to, and, you know, we learn it by practice and by, you know, mastering, you know, the craft. But that end range of motion, that's the point where you actually thrust. Okay. And that thrust is where you hear the cavitation. That's where you hear the cracking sound, right? And what's the point? What's the purpose? So the purpose is to increase your range of motion. So if you've noticed, if you ever watch some of my videos on YouTube, after I adjust someone, it's like, oh my God, oh, I couldn't turn my neck. Now I can't, you know, and they're not exaggerating. That's what the adjustment, that's what it does, you know?
Okay.
So unless you get to that end range of motion and you're just going to the extreme, it's really hard to hurt someone. Now, I'm not saying that the regular person can go adjusting your neck. Of course not. You have to be trained. You have to, you know, take courses and so forth. But it's not that that crazy. It's not that insane.
Now, what about with that Y strap though?
With the Y strap, well, you know, once again, you know, you have to take a history and see, you know, if the person.
Now explain the Y strap, because I don't know what a Y strap is.
Okay, yes, so yeah,
I mean, you say strap, I go somewhere else. So.
Not that kind of strap.
But this is the one that was acting innocent before we got on, right? Okay, go ahead.
Oh, no.
Yeah, touche. Go ahead.
You were saying, doctor.
Well, the Y strap is fairly new. So basically, it's used for decompression. So imagine, you know, your spine being compressed, and a lot of people, when they come to me, they have a lot of stiffness, soreness, and they've never seen a chiropractor, you know, for years. Or actually, some of them is the first time seeing a chiropractor.
I've never seen one.
You've never seen one. And also, I have people who may have like compression issues, for example, tingling down the arm where there's compression on the nerve. So basically, we use the Y strap to kind of help decompress. Okay. So it's more like a temporary type of relief, you know, and with any chiropractic care, physical therapy, I always tell people most of the work, they have to do most of the work. You know, we just kind of give them a head start, you know. So we do the adjustment, we'll do the Y strap to kind of decompress everything, prescribe certain, you know, exercises to do. But that's basically what the Y strap is, to kind of help decompress the spine.
So, but how does it look like? I mean, because it looks like it's like a pulley type thing.
Right. Yeah, I got it done a few times myself.
Yeah, I seen a video. I believe you have it on a video, correct? I seen that
video, yeah, where another chiropractor had adjusted me. Yeah, basically it goes around the neck, and then we put the neck into some tension. And then once we get to that end point, we apply a thrust, and then you actually hear it. So you hear, So, but it feels good, and most people usually after the Y strap, they'll be able to move a little bit better. Their range of motion will improve. So I've actually gotten great results with it.
So what about like someone like me who has never been to a chiropractor? Would that make me more loosey-goosey, or it just wouldn't do anything? Or how would that work for someone who doesn't really need it per se immediately?
90% of my patients, when they leave my office, they'll call me the next day and say, "Oh, it was the best sleep I had in a long time."
Really now?
It feels like if you watch any of my videos, it's not
Don't
just.
tell us she could sleep.
Okay.
Don't tell us she gonna be able to sleep.
Okay, for real.
Yeah, if you watch any of my videos with our clinic, it's multidisciplinary, meaning that we have massage therapists and physical therapists.
Yes, I can't wait to
connect that.
Right. So it's not just you come in and get adjusted. So like any of my videos, we stretch the patient, we do exercises. Then after that, we do the adjustments. After the adjustments, they'll actually get like a 20-minute massage. So it's stretching, massage, exercise, and the adjustment. So if you go on my YouTube channel, you click on any of those videos, you'll see exactly what I'm talking about. So
all 4 of your clinics are set up like that? Also 4 of your offices?
No. So the clinic where I see most of my pain patient, chronic patient, that's in our Southeast location. The other clinics are mainly for car accidents, like you're familiar with.
Okay.
Yeah.
Okay. And you're in the DC area, correct?
Right. We have 2 in DC and then we have 2 in Maryland. But the one in Maryland, I'm actually going to probably slowly close it because once again, I'm doing some stuff in crypto and I'm trying to get my time back, so.
Right. Yeah, we're gonna talk about that. That's hot.
Yeah.
So let me see. Bernie asked, what is your take on a foam roller for back therapy?
Yeah, foam roller is actually pretty good. So, a lot of people, they may have, upper back pain, mid back pain, stiffness, soreness. So foam therapy will help as far as, decreasing tension and muscle soreness. So yeah, I actually recommend like a foam therapy. It's very helpful.
Trash Can Wave said, this guy looks like an actor you played in any movies.
No, I no movies.
You probably saw him on his YouTube channel. So y'all, I have it scrolling at the bottom. I believe I have it written correctly. Dr. Nesly Clerge, DC, which is Doctor of Chiropractic, Chiropractor on YouTube. I'm sorry, I've been hanging around my dogs. I haven't been around a human all day.
Did she blame the dogs?
It's true. I haven't been around humans. I haven't been on the phone or anything, so I can't talk today. Yeah. Even when I'm at work, all I do is just bitch and complain. So speak proper. Shoot. Anyway, besides the point. Yeah. So what were we talking about before I started stuttering? Like I don't have any sense. That you haven't been on any movies or anything.
No, I'm not an actor. I think what was it?
Oh yeah, we talked about your YouTube. Yeah, your YouTube. I have it correctly. Yeah, y'all check out his YouTube. He has like 50,000 subscribers. So y'all go over it. He has it's actually really, really awesome. Like all of the Y strap that My Vivid Life talked about, and all these different things. And he's right in DC area. You have like people that come all over the place to come see you, right?
Absolutely. So I've had somebody from Sweden. Actually, I posted her video, like a few videos back, like 2 months ago. Yeah, she's in she's one. I forgot the name of the group, but she's a singer from Sweden, and that group is very popular. So she took a flight and came down, and we did a full treatment. And I've had a lady who drove 8 hours. I've had people from everywhere: California, New York, Atlanta,
Texas,
everywhere. Texas, yeah. Actually, usually we're pretty booked. Like month of December is booked. Like I have no slots for month of December.
Why is that? I mean, you're just saying December, or always in December they do like gift cards or something, or why is December? Or just
we're just booked. Typically 6 to 8 weeks it takes for someone to get an appointment with us.
Wow.
So usually what I'll do is I'll say, hey, I know a few chiropractors where they can see you right away. Just go to them. So I'll refer to other people. But yeah, we typically are booked. Yeah.
Right. So what is so amazing that people, I mean, if y'all look at his videos and y'all will see what I'm talking about, but I'm just going to ask you, what is so amazing about your practice and how you do? I mean, first of all, what made you start off with one practice and then expand it to 4? Like, a lot of times people, they just satisfied with the one and that's all they can handle.
Right.
But you were getting so many people that you had expanded to 4 practices. I mean, I don't know about y'all, but I'm just like, that blows me away. That is, and then you still have a wife, beautiful wife. You have a family, a new baby. Like, how do you keep all of that going? But what made you be like, listen, I want to make this like an enterprise. I don't want this to be a one set thing. I want this to be a big time legacy.
Right. So I mean, I'm a driven person, you know. I'm ambitious as well. So, you know, I never put all my eggs in one basket. So as you know, I wrote the books. I made money off of that, because I actually
hold on. You write books?
Right. I wrote, like, if you go on Amazon and you type my name in, all the books will come up. And that was, I actually wrote these books when I was going through my divorce. And, I did well with that. So, I didn't stop there, then I started the practices and then I expanded to that, and then I did Instagram and I did YouTube. So like my wife always tell me, I just can't stop, so.
And you do all kind of different things too. I mean, I looked you up, next thing I saw, he got 50,000 subscribers. What?
So,
just because, I mean, but their videos are, I mean, like you said, people love to hear the cracking. And it is like pretty weird, like how, it looked like it's such force and how it doesn't hurt, but people are like, they're like, oh God, that was so great. Thank you so much. They love it.
Yeah, it feels amazing. If you've been to a good chiropractor and actually got, some well-performed adjustments, you'll actually feel really good after your session. So yeah, it feels good. It feels good.
Yeah. So what about so back to the sleeping part. So how does like someone who doesn't really need any adjustment or they think or don't have any immediate issues, how does that get the body to want to relax enough to have a proper sleep cycle so you're saying it can possibly cause a natural sleep cycle to
not that it can cause a natural sleep cycle. It's just the fact that most people are stiff and they just don't know it.
Yeah.
Until you move your neck and say, oh man, I feel tight when I go this way, or when you do some lateral flexion, like, oh, why is this so tight? You don't know it because that's not typically, you're not moving like that, right?
Right.
But then when you go to a chiropractor, you get assessed and you're like, oh, this is tight and this motion is restricted. And you get, well, with us, I don't know about other chiropractors. I know some chiropractors is just the adjustment, but with us, it's the whole thing. So you get stretched, and the stretches are for muscle flexibility. So we're increasing your muscle flexibility. After the stretches, we're actually adjusting. And the adjustment, that's for your joint range of motion, okay? So after the adjustments, then you're getting a massage. So at the end of that full session, you feel so relaxed and you're limber, your joints are moving well. Most people, when they go home, it's like, wow. And they go straight to sleep. And I've had that call several times where they'll call me and say, oh, wow, I slept really well. I feel so much better. And that's why we get a lot of people from other states coming in to get treatment from us.
Okay. So that is pretty good. I mean, all the way from California, all the way from Texas. So how is your practice set up? What made you have like a multidisciplinary practice? Or, I mean, because most chiropractors, they don't have that, correct?
Right, they don't have that. Well, I mean, it's a long story. I know when I first started my first practice, that was in Washington, D.C. Actually, I was an employee. I was an associate doctor.
Okay.
I worked for 2 other doctors. Went to work on Monday. Wednesday, doors were closed because they had a dispute, financial dispute. So at that point in time, I took the practice. I took over. And the first 2 years were absolutely horrible. I made no money, no sleep. Like any other business, most people, you start a business, it's, it doesn't do well in the beginning. Kind of like how you start on your YouTube channel.
Right.
The first few months, year or so, it will be tough. It will be discouraging. It's like, oh man, I did all this work and I only got 2 subscribers. You know what I mean? So it was the same thing. I started the practice and I'm like, where are my patients coming from? I face eviction notices. Anything you can think of, anything that you can think of should go wrong, went wrong. Right.
It kept going.
And that's the time where most people say, you know what, forget it. I'm done. I'm just going to get a regular job. But, I just kept going, So when I started that practice, to answer your question, I didn't want it to be just a regular chiropractic office, because most people associate chiropractic for accidents. Oh yeah, I had an accident, I went to a chiropractor. So I wanted the practice to be unique. I wanted it to be different. So I said, okay, I'm gonna make sure I have a chiropractor, a physical therapist, a massage therapist, and at a point in time, we actually had a medical doctor in that practice. So
Okay.
I just wanted it to be very unique. And I think that just me being that way, or the practice being that way, attracted a whole lot of different, types of people.
Okay. And is it considered holistic medicine? Since you're
Um,
not really dealing with medicine when it comes to chiropractic medicine, or is that kind of a stretch?
well, I wouldn't say holistic medicine. It is natural in a way, but I think a lot of times, not to say anything bad about holistic, when people say holistic, they just think about, just holistic, natural, voodoo, type of, I mean, once again, nothing wrong about being holistic.
Right. Because it's there with science, hard
Right.
science.
They don't, there's no collaboration with science, basically, when you think holistic. Where with the practice, it's more scientific, when we do our assessment, we're assessing range of motion, the degrees of range of motion. We're taking a history to find out, are there contraindications? Are you taking medications, blood thinners, things like that, where it may cause an issue if we did certain adjustments. So it's more scientific. And then we also refer to other providers, orthopedic doctors. If you may need a neurologist, we'll send to neurologists. So is it not really holistic? Because I've had patients who came from other chiropractors, and they were very holistic. And when I say holistic, they didn't really take a full history, and they were talking about a lot of subluxation, which is something that older chiropractors tend to talk about, and I try to stay as scientific as I can.
Okay, right.
So that's why I don't necessarily think it's holistic per se. Now, there are holistic chiropractors where it's strictly holistic, with us, we're taking the full history. We're doing the full thing, to make sure it's very beneficial for the patient.
Okay, so like any kind of healthcare field, chiropractor have their own holistic side to it. There are people only practice holistically.
Absolutely. So there are chiropractors where, they're not going to do all this extra stuff with the range of motion, and they'll still do the history and so forth, but it's more holistic, where hey, you have pain, it's subluxation, is because of the nerve is putting pressure, or the disc is putting pressure on the nerve, so it's subluxation based, it's holistic based. In certain things they don't do. With us, it's a little different. We want to take, once again, full history. We want to make sure there are no contraindications. We want to make sure we're getting the full picture. And if you have to refer you out, because sometimes I have a patient say, you know what, I don't think chiropractic will help you. Okay, you need to see an orthopedic doctor. You need to get an MRI done, because this is more severe. This is a severe case. So it's not where a holistic doctor may say, oh yeah, sure, we can treat that. It's holistic. No, it's with us, it's more scientific.
Gotcha.
Okay. I like my Vivid Life question. If you crack your knuckles, does that make your knuckles fat? I was told that too by my mom, but I still crack my knuckles.
My mom said, "Don't do that; it'll make my knuckles fat." Nah, that's not.
Yeah, I still crack mine.
So basically, when you crack a joint and you hear a popping sound, right? You have fluid that surrounds that joint.
Okay.
And gases are escaping, causing that crack, that cavitation. So to kind of to give you an example, if you have a soda bottle and you pop it, because of that pressure and gases escape, that's where you hear that, right?
Right.
It's the same scenario when you're getting into that end range of motion, and then you adjust and gases escape, it creates that cavitation, which is that cracking sound. So we're not cracking your bones, is basically because of gases that are escaping. That's why you hear the popping sound.
Oh, so you're kind of doing a good thing?
Yeah, absolutely. I mean,
cracking knuckles.
You can crack knuckles all you want. Yeah, that's not a problem.
Okay, so because it's always been said that cracking your knuckles is a bad thing.
No, it's not. It's a myth. I mean, you can look at any of the literature. At first it said it will cause arthritis, but the literature doesn't support any of that stuff.
Okay, that's interesting.
I
Okay.
still wear a size 5 ring, so clearly it didn't make my knuckles fat.
So that was a really good question because yeah, that was a big time myth that I still know of, even at 29 years old. Let me see. Speaking of neck pain, I noticed that my neck is sore if I look down at my phone instead of bringing it to eye level.
Absolutely.
So that's what I Y strap, busted that Y
I
strap.
get that too.
Like, yeah. Let me see. Let's see. Have to place your phone on your ceiling. Okay.
Hold on. You meant phone or mirror?
Anyway, thank God you didn't come to the 8 o'clock one because it'd be extra goofy. We say make them swollen so no tune up or old changes. Okay. All right.
What?
Okay, so
hold on. Now I got to read that. What?
Okay, all right. So what's the difference? I mean, I know this is like a question that I get asked a lot with what's the difference between a technician, a pharmacy technician, a pharmacist? But what's the difference with physical therapist and a chiropractor?
Okay.
I know the difference, but just to make sure to clarify the demarcation.
Right. So physical therapists, they also treat the musculoskeletal system.
Okay.
The only difference is everything a physical therapist can do, a chiropractor can as well.
Okay.
So neuromuscular education, electrical muscle stimulation, therapeutic exercise, all those things are under the realm of a physical therapist. Chiropractors can actually do those things as well. Now, the only difference is a chiropractor can order MRIs, we can order X-rays, we can order lab work, we can adjust. Now, I do know some physical therapists who can adjust, but based on our license, we're the only profession where we can actually adjust someone. That's the cracking portion of it. And then in certain states, like for example, New Mexico, and also in Switzerland, chiropractors can actually prescribe medications. So, so those are the differences between a physical therapist and a chiropractor.
So what about physical therapists who went on to get their doctoral degree? Would that be a difference in what they can do medicinal wise or medical wise versus a chiropractor?
Because I'm not a physical therapist, I'm not sure, but I do have a physical therapist who works for me, and he's a doctor of physical therapy.
Okay.
So he's a PT DPT, meaning that he has an extra doctoral degree, and I think it's in the Army, but don't quote me on this. And I believe they can either write X-ray or get X-ray referrals or give out X-ray referrals.
Okay.
But I'm not sure. But they do have additional education, when you do get like a doctoral degree as a DPT.
Okay. So I love what you said with, you started off and you took over a practice and it took you 2 years to kind of get it stabilized in a way it would be, good for everybody.
Right.
But you didn't give up. And that's the thing, and that's the thing with YouTube, because a lot of us are new YouTubers. And what you also mentioned, this is the point where you like, oh, I'm getting tired of it, because as humans, we want quick return.
Absolutely.
And a good thing with, I guess you were really good at keeping, pushing forward, especially when you're YouTube too. And that's what I'm trying to use my pharmacy to keep pushing forward, because we had to go through so much crap for a long period of time. So that kind of build endurance. But so for all of us YouTubers, it can get difficult. So let's just, push forward. And when it gets really, really, really whack and really, really terrible, that's when we're going to have a breakthrough. So I love that. So,
Oh, no, I'm sorry. Go ahead.
Oh, no, I'm almost done.
Okay, so I have a question about chiropractic experience that I had. So I don't remember all the details of it, so I apologize about that up front. But I had yet another accident. And so this was as an adult and sedative. So I was, I had to go to a chiropractor, and the way she was trying to explain it to me was right there at the base of my neck. The curvature was wrong. And so whatever she was doing was supposed to correct that. And so over a period, I think, I want to say about 6 to 8 weeks, and I was going twice a week. And then when I was x-rayed again, it was further in the wrong direction. Okay. So she wanted to continue to try to reverse it again. And I was just like, nah, you're not about to play with me anymore. So, because I wasn't getting any relief at that point. And she was actually, because I've been to probably about 4 or 5 different chiropractors over the years. And she was the first one that I would say caused more damage or I didn't really get any relief from.
I understand.
So, can you tell me what she did or what happened there?
I always say whenever you decide to go to a practice or any doctor for that matter, whether it's a chiropractor, dentist, medical doctor, orthopedist, whatever, you always have to do your due diligence, to see who you're going to see, Now, I personally, I can only speak for myself, I can't speak on other people's practice, but I don't take x-rays unless it's necessary. Okay. I don't re-x-ray because I don't want to expose my patients to unnecessary radiation. Okay. Now, x-rays, in my point of view, should be taken when you suspect some type of bone pathology or some type of fracture. So if I'm taking a history and, based on the history, I say, oh, the patient may have osteoporosis or the patient may have had a trauma where I may suspect a fracture, I'll send you for x-rays. But I don't take x-rays for, say, a correction or alignment purposes, which I don't believe is something that has any literature behind it. Okay. So me personally, for my practice, I assess, I do the range of motion. If you're restricted, then I'll adjust you. And then most of the people that I see, they don't see me often. So I know some chiropractors may see you twice a week, 3 times a week. Sometimes I see my patients 3 times a year. Okay. Because especially if you don't have any major issues, most of the work is done by the patient, and that is by being active, by increasing your activity, exercise, and so forth. So in your situation, if you came to me, I'd do an assessment and I'll check your range of motion and see what I can do to improve them. After that, I'll say, okay, these are the exercises you need to do. These are things you need to do at home. And then I'll see you in about maybe 8 weeks, right? And the next time I see you, I'll see, did you do your exercises? Are there any improvement? But, I can't, that's not my style of practice. So that's what I can say about that. I can't, I don't know what their style is, but me personally, I don't practice that way.
That's so weird to me because in all the years that I've gone to chiropractors, none of them ever gave me anything to do at home. The only time I received anything at home was when I went to physical therapy.
Right. So
I think was it.
Yeah, there's like a new breed of chiropractors now. I think, like I said, back then it was more holistic. And that's the reason why there's such a misconception about chiropractors. Oh, they're quacks. They're not real doctors. They didn't go to school. They only, you only need a year of schooling. It takes 8 years. You know what I mean? And if you like, for example, with your situation, if you had a bad experience, then you think all chiropractors are quacks. It's kind of like when you meet a young man with his pants down his butt and, he's acting crazy, and all of a sudden, all Black people are the same, So it's a stereotype. So it's the same thing for the profession. And I think the folks old folks who are not trying to evolve, it's basically creating a bad name for it.
A lot of times too, African Americans, when we go into the professions, we have to be on that other level. So Absolutely. You probably subconsciously or maybe consciously on this other level because we're so quick to be challenged on Absolutely. Our knowledge and stuff of that nature. So a lot of I had a patient, client that was like, "Oh, I know you're gonna do this vaccine really good because you're Black." And I'm like, I was like, okay. And then he was like, and I go to a Black dentist too, because I know I'm gonna get the best work. I was like,
yeah, I get that all the time.
You did do a better job of giving me my shot than the other guy did. So.
I got you. Shoot, they on me.
She did. I mean, she really did do a much better job, and she was way more clean. She's super OCD, like I am. I'm a big germaphobe, but she takes it to a whole nother level.
I see.
She even sterilized her gloves. I mean,
It's the same, I'm the same for me. Yeah, it's the same. I'm the same way.
Yeah, so I love it. But the other guy, my arm hurt when he was finished.
So unique view. Let's see, what's the question? What are the most common causes of back and neck problems? So it's multifactorial. And the reason I say that, nowadays with social media, people are on their phones all the time. So you're more into
this number here.
Yeah, forward head posture. So that creates neck problems. Lack of activity.
Pharmacists, we always bend our neck down looking at the computer. So you probably see a lot of us with a little neck hump.
Right. Lack of activity that can create, stiffness, soreness, aches, muscle issues. And the other thing too, a lot of people don't know the proper way to sleep. So you should be on your back with your legs elevated. And with the proper
position.
Yeah. So most people sleep on their stomach, which is the worst way to sleep. So I get a lot of patients who come in and during the history, I'll say, how do you sleep? And like, oh, I'm on my stomach. So imagine being in this position for hours.
Right.
And the amount of pressure that you're creating in the cervical musculature. So it's multifactorial. It's not just one thing.
Right.
So what are your top patients?
What do you mean? Like
your top complaints? What are your top
complaints? We get a lot of neck pain. We get a lot of back pain, and then we get a lot of folks like my age. I'm 44, so a lot of the folks will come in. They've never been to a chiropractor before, and they have a lot of joint pain.
Okay.
That's the majority of our patients, musculoskeletal complaints, and then we have the older population in their 60s, 70s. Now, these type of folks, we don't do those aggressive manipulation with them because obviously age is a factor, which we don't want to cause any issues for them. So it's mainly more like a physical therapy, stretching, gentle, passive, active range of motion. So if I have a 70-year-old with arthritis and osteoporosis, I won't be doing high velocity adjustments and Y straps on them. I'm gonna take a more passive approach. So that's why we're different, compared to everybody else.
So sleeping on your stomach is not a good thing. But
I haven't done it in years.
Really?
It hurts. Oh my God, I wake up in pain. I don't do it anymore.
Yeah. Oh, what are the percentage? Do you know the percentage of people who sleep badly? Probably like 90%.
Everybody.
Yeah,
100%.
I can't really pinpoint a percentage, but I know a lot of my patients, they sleep on their stomach. So if you can't sleep on your back, the next best thing would be to sleep on your side.
Okay.
And you put a few pillows in between your legs. That way you can kind of create more of a balance.
Okay. I need to know this because Trash Can Waves is that. Have you ever heard of a cuddleist?
A catalyst?
A cut like.
Did you make the appointment? Someone that cuddles with you, someone you pay to cuddle with you, a cuddleist.
Oh yeah, I won't be able to spit it out. Yeah, it's called a cuddleist, and they are professional cuddlers.
I've seen that though. I've actually seen a documentary on it. Like people will come and cuddle with you, and you pay to go like for someone to cuddle. Yeah, I've actually seen something like that.
Did you schedule the appointment?
No, I'm going to, but
you need to hurry up.
I know. I mean, there's so many cuddles. So, I mean, I'm pretty sure I don't have to, but I'm going to get a cuddle. But I'm going to do that. So when you say pillow, remind me because they take a pillow and they separate you by a pillow, but yeah, so there won't be any contact per se. But yeah, I'm going to do a live stream on cuddles. I'm going to do
actually, I think that would be a great idea because you probably get a lot of views from something like that. Yeah.
And this heifer wants to go to sleep. I'm telling you, she'll do anything for a nap.
It's going to be quite a boring stream because as soon as I lay down, they're going to want to probably, well, how was your day? And I'll be snoring like, leave me alone. I got you, Trash Can Waves. I am definitely, Kay's on me. We already got the arrangement on the date. It's actually next week, right?
It's the 17th.
It's on a Wednesday or Thursday or something like that.
You said the 17th. You could do the 17th. Both of you guys
are going. Both of you guys.
I'm going to go, one, to watch her back, but also to film it.
Right, because they have like a cuddle hub or something. It's like a whole. They make good money too.
Yeah, they do. I've heard about it. Yeah, they actually.
She actually wants to do it because this heifer again wants to go to sleep. Said if she could get paid to go to sleep, she will be the best cuddler on earth. Except she's not going to ask any questions. She's not going to ask you about your day because this heifer going to sleep.
Right. I'll probably ask you, are you comfortable? And then I'm going to sleep. Then I don't know what you're going to do, but I'm going to bed.
trash can waves, or with me, it's going to be contact even to the pillow.
The pillow ain't gonna be enough. It's not gonna be enough.
Well, I'm not Kay, so you don't care. Remember trash can waves. So anyway, so your family life, and I'm not gonna keep you for too long.
Hold on, are we still talking about chiropractic, right?
Yeah.
I got a question. Is chiropractic care generally covered by medical insurance?
Yes. So now most insurances do cover chiropractic care.
Okay, that's a good question.
Me personally, I don't take insurance. Yeah, the reason why is the type of care that we provide, insurance wouldn't pay for it to begin with. And I don't, so basically and this is not everybody, this is just, some chiropractors, when you take insurance, it's quick, but with me, with like my sessions, they usually last 2 hours.
Wow.
So if someone travels, 8 hours to come and see me, I'm not going to see you for 20 minutes and send you on your way,
Okay.
Right. So we're doing massage, we're doing stretches, we're taking a history, we're doing adjustments, so typically our session is about 2 hours. And I'd rather focus on the session and focus on the patient than to think about insurance. Because what happens is that when the patient comes with insurance, you do the treatment, you send the bill out, and insurance only pays what they're paying.
A portion.
For example,
right.
If we do electrical muscle stimulation, or if we do manual therapy, if we do exercise, they only pay a certain portion. And sometimes they don't pay it. So I don't want to have to deal with that. I'd rather you pay a set fee and you get quality care than me rushing your treatment because of insurance. So that's the reason why I don't take insurance.
Okay, well, how much is a 2-hour session?
The first session is $225.
That's not bad at all.
And
for 2 hours? For 2 hours?
Yeah, for 2 hours.
You pay that with a hooker for 30 minutes. I mean, I'm just saying.
Because you're talking about it's $20 in Charlotte. So I heard.
And depending on if it's done with a Thai massage, I believe it's $275. So I don't know if you guys know what a Thai massage is. I have a young lady who works with me. She's a licensed massage therapist. So if you want to know what it's like, go on my channel and just look up the Thai massage section. And it's a lot of deep stretching. She's walking on your back. She's, it's like a 30-minute deep stretch.
I had a massage done in Bangkok. Oh my God, it was the best thing ever. Oh my God, and it was dirt cheap too. It was like the equivalent of like 13 USD. I was like, what? But anyway, I digress.
So from start to finish, what do we expect when they come to see you from start to finish?
So from start to finish, they come in. I'll see them and take a history. After the history, based on what I find on my examination, then I'll do an examination. After the examination, the ladies will take over, and that's either with regular stretching or a Thai massage. So some people have a Thai massage package. The Thai massage will last about 30 minutes. After the Thai massage, then they'll come in and see me for the adjustments. So then they'll get adjusted. That typically can last anywhere from, I don't know, maybe 10, 15 minutes. After the adjustment, they will get regular massage from the young ladies. After the regular massage, they will get what they call electrical muscle stimulation. Those are electrodes that we'll put either on your back or your neck to kind of help decrease muscle tension. And then we'll put them on a table, intersegmental traction table, like a roller table, to help with range of motion. So all of that usually will last anywhere from 1 hour and 45 minutes, 2 hours, sometimes a little bit over 2 hours.
Wow. And they're just loving it. And that's why and so you're one of the few practices where it's like a 2-hour ordeal.
Exactly. So most chiropractors, when you go, it's usually in and out. You go in, get your adjustment and you're done, or you go in, they'll do a few stretches, adjustment, you're done. So typically sessions will last 20, 30 minutes. But with us, it's you're there for a while.
Yeah, because I know when my sister went, I mean, we talked before she went in, and then before I even had time to really do anything else, she was done. I'm like, so what?
Right.
And like you said, I mean, I'm just now thinking now that you said about chiropractors being quacks. I mean, I haven't heard that in years. And I think I probably definitely dispelled that after, knowing you, from all your work and everything like that. So, but yeah, that's definitely not the case. And you even like I said, you have a physical therapist on hand, so they don't really need to leave you.
Right.
They are taking care. So someone from California, from other words, they are taken care of.
Right. So
Mhm.
yeah, basically when people come in from, let's say like a California or Atlanta, we get a lot of people from Atlanta. They'll come in for the weekend. So usually they'll say, hey, I'm coming with my family, you know, I'm coming from the ATL. Like the lady who came from Sweden, you know, she came for the weekend.
Okay.
So typically they'll do Friday, Saturday, or Thursday, Friday, Saturday. So it'll be like a 3-day type of thing. That's typical for most people from out of state.
Wow.
Okay.
So, okay, before I go into the family stuff, do you have any other questions or anything?
Yeah, I'm still on this. I'm still on this. You ready? You ready to move on? All right. I got a question. Okay, so have you heard of the TENS EMS?
Yes.
Okay, what's your opinion on that?
No, those are actually they help, you know. So for example, you know, sometimes patients will have stiffness or, you know, aches, and I'll say, hey, just get a TENS unit. It's a passive modality, meaning that something that you just put on and it works. I mean, it helps, you know.
Yeah,
And
it does
it'll help to a certain extent, you know. I wouldn't say, oh, just use TENS for everything.
Oh
But
gosh, no. But
really
I
what
love
it
mine.
does, yeah, what it does, it increases blood flow to the area.
Okay.
It decreases, you know, muscle tension, so on, the stiffness. So, you know, you wake up and then you have some aches, you know, around the traps. You know, you can put a few TENS unit, you know, electrodes and turn on the TENS unit. It'll provide some type of relief, you know.
Oh
But
yeah,
it's
I sleep in mine.
yeah, it's still passive, and you still probably will need to see someone, either a physical therapist or chiropractor, for, you know, any issues.
Now back to that quack piece. Like I used to hear that a lot, you know, back in the day. I haven't heard it a lot in recent years. And I think the reason for that basically is because back in the day, I think people really didn't understand any medicine that didn't require you to take a whole bunch of pills.
Right.
Or didn't require a whole bunch of machinery and, you know, surgery or whatnot. So anything else was discounted. But now that we're opening up to other ways of treatment, I think you're definitely in a field that garners more respect than it used to.
Right.
Because people are more open to other ways of healing and trying to get away from the medicine.
Absolutely. And you know, quacks, you have quacks in every profession, you know.
Except pharmacy. We don't have time to be. We just have time to mess you up.
But I just think I think a lot of people, you know, they'll go to a chiropractor and they'll have a bad experience, and based on that experience, they'll tell their family, their cousins, their brothers, and then that person will kind of pass that same information on. So that's where that whole thing comes, you know. And most people are not aware of what the chiropractic education is anyway, you know. So and then if you think about it, you go to a chiropractor, all he does is crack your neck and your back, you're out in 10 minutes. How hard could that be, right? So you tell someone you go to school for 7 or 8 years to learn that, they're not going to believe you. But it's more than that. It's more than just cracking your neck or cracking your back. I mean, there are certain things we have to look out for, you know, certain.
But even that part of it, just the cracking, I would still think you had to go to school for a while to know how to crack me properly, so you didn't break me, you didn't injure me.
But most people think, oh, it's just, you're just cracking a back, you know. But it's more than that, you know. You have to know exactly what you're doing. You have to know that person, the history. You know, there's a lot you have to take in consideration. You know, what vectors to use. You know, what type of force. So it requires thinking. You know. But
is it some physics? Did you have to study a lot of physics as well?
No, you don't have to study a lot of physics, but you know, you learn. You know what? For example, if I'm on top of the table and I'm doing an occipital lift, I have to know, you know, what motion I'm using. You know, it might laterally flexing a little bit more, depending on the person's, you know, body mass. You know, do I need to? So there's a lot I'm thinking about, because everybody's different. So I may get someone who's really heavy set, and then I have to think, okay, how am I going to adjust this person? How am I going to increase their range of motion? What adjustment do I need to use? What techniques do I need to use compared to somebody who's a little bit slimmer? You know, so all of that we're thinking.
You're going to need more pressure to get past all of this. You're going to have to put your back into it.
And watch this YouTube, because, you know, there are some people that are bigger than others. And like you act the same way with each one of them. Like I don't see you stressed. I don't see you like, like, okay, let me get ready here,
Right.
Like you just go in and because it's all about, everything you do is so measured and controlled. So
Right.
I guess, it's like you said, it's more of a mindset and, a mental thing versus a whole body thing. So I think that is very interesting how you have like a little, small person, built person, and you just do it, and then you go in the same way with a heavier person. So that is pretty interesting. Yeah. So that is more of a mental.
It comes with experience, the more people you adjust, and not everybody cracks, not everybody pops. Some people are extremely stiff and their muscles are just simply too tight to hear any cavitation. So in that instance, I'll do something different, maybe do a different passive range of motion, active range of motion. But with experience, you'll know exactly what to do.
Yeah. So cracking is a part of it. So cracking is equates to results.
No, not necessarily. Okay. I think people equate cracking with results.
Okay.
So they want to hear a pop, because when they hear a pop, it feels so good. So they have to hear that pop to feel like something was done.
Right.
But it's not necessary.
Okay, gotcha. What's that, Kay?
I didn't say anything.
Oh, I thought you had another question.
Did I?
Oh, well, you said you had
I was gonna ask about well, I just did it in the chat though. What I was gonna ask about, Trash Can said something about a massage chair, and I was wondering if he actually has a massage chair, because I have one. I bought my husband for Father's Day last year, and it is freaking amazing. So because I talked about it so much, my mom, well, she couldn't keep her behind out of mine. So my siblings and I, we got together and bought her one for her birthday. And she's hopelessly in love with it. And my other two of my sisters have one, and my brother is planning to buy one for Christmas this year. So, we're all hopelessly in love with the massage chair. So I don't like the one my mommy has. It doesn't stretch out. I'm kind of tall, and hers doesn't stretch out and give me that extra leg room like mine does. But it does have the zero gravity, which makes it kind of nice, but it's not as awesome as mine is.
Now, speaking of which, are there any products or any like massage chairs or those massagers that you're totally against that does more harm than good? Like the Tim's unit, you're okay with that.
Right. I mean, typically, most products tend to help. It's better to do something than nothing, because I get a lot of companies. I actually had a company who sent me some sneakers the other day. Like they'll send me stuff so I can like do a video on my YouTube channel and go in partnership with them. I've got a lot of those offers, and I just kind of shut them down, except for one that I'm considering now. And it's not because the product is not good. It's just if you want to associate your name with something, you have to make sure that your reputation is there. But most products, they're okay. Like massage guns, I recommend those for patients. Certain chairs. I know there's this company called Ergo RX. They have these type of chairs that are ergonomically correct. Help as far as your posture and making you sit upright. So there are different products. I typically recommend it to patients.
But is there anything that is totally contraindicated by you that is going to do a lot of damage? Do it.
Not that I can think of. Nothing that's going to cause that much damage. But then again, I haven't really seen any products where I'll say, "Oh wow, this you can't use."
Right.
I mean, I don't know. I'm sure there's probably something out there, but I haven't seen any of them.
Right. How do y'all feel in your practice about like turmeric? Because a lot of people talk about using turmeric and turmeric is a vitamin you find in the vitamin section.
Right.
A lot of people would like to use it versus using like ibuprofen or leaves. So how do y'all feel? I mean, because to me, it doesn't do.
I just ordered some turmeric from your girl the other night. Her volcanic turmeric. I ordered some of that from your guest the other night. What was her name?
Yeah.
Nature's Nurtures. Yeah, right. I did order some from her. So I haven't done the turmeric thing up until now. I've heard about it for inflammation and stuff like that, but I said, hey, I'll give it a try.
Right. I tried the one that's over the counter at Walmart. So, you have to make sure the purity and stuff is right for the good effectiveness.
Yeah, the natural product.
Now but I got mine from Walmart. I ain't got the good stuff from Nature's Nurture, so I don't know how that would go. So you would have to tell us. Yeah, but how does your practice feel about or what's your experience with turmeric versus using typical ibuprofens or NSAIDs?
Well, I like anything natural. So, anything that has some type of research behind it, I typically recommend. Now, the only thing I tell patients is, make sure there's some type of, make sure it's reputable, so don't just go in on Amazon and just buy, products without having some way to research or some way to search and see if you're getting what you're supposed to get. That's the only thing that I have against, buying them. It has to be from the manufacturer or from somewhere that has a good reputation.
Right. I mean, but have patients that you dealt with, they say that they prefer it versus.
Oh yeah, no, absolutely. I mean, most of my patients typically, don't want to take medications because, there's side effects, So, any products, like anything, even glucosamine chondroitin, which I'll tell people to take for their joints, compared to taking, medication. Less side effects, and absolutely, yeah, I completely agree with them.
Oh, okay, so you're a fan of glucosamine with chondroitin then?
Yes, because I take it myself.
Okay, yeah, with glucosamine with chondroitin is in the vitamin section, and it's a two-part word or two-part medication, but it's all in one. And a lot of times, like you said, like if you have osteoporosis and the bones are rubbing together because you don't have like the cartilage in between or any kind of joint pain and stuff. But the thing is, you have to use it for over a month to get real full effectiveness from it. But a lot of people now, I have heard that was amazing. I have not heard one person that's taken it and is like, oh, this is horrible or this is not doing anything. The turmeric is dicey, but with any kind of product, you have to really get the right branding.
Absolutely.
Right. Yeah, and the purity, or otherwise you can just be buying
just junk.
Exactly.
Right.
Right. Glucosamine with chondroitin. You know I don't know how to spell it. Stop it. He asked me spell it, please. I'm gonna try to type it in there. Okay, so how did you do your business and your family life? How did you keep going? I mean,
how do you balance it?
Yes.
It's always hard to balance business and family. And I think most people who are successful, they had to sacrifice something. Okay. It's really hard to, to say, you know what, I'm going to have a family, I'm going to have a business. You really can't have both. I mean, you can, but if you want a successful business, you have to put the time in. Okay.
Right. Yes, you do.
When I started my business, I worked 7 days a week, So when I started that first business and I took over, I was constantly in the red. Okay. So meaning that my account stayed in the negative, So I had to work 7 days a week at other places. So the money I was making from that place will cover my bills in the business. I did that for about 3 years.
Wow.
So the first 2 years, I worked about 7 days a week for the first 2 years.
So you had your business and then you work another job.
That's right.
In your profession to cover
the expenses. Right. So I had 3 jobs basically. Right. So I worked 3 jobs. My wife then was also working. She was a nurse. I'm sorry, what'd you say?
I said, go ahead.
Yeah, so my wife then was working. She was a nurse, and the money we were making, I'll use that to kind of cover expenses, the other business. So as far as family life, I'm gone early in the morning. I come home maybe 10 at night. Wow. And then when I come home, I'm actually doing reports. So I'm up 2, 3 in the morning and then start again, And I think that's what differentiates me from other people. When people say, oh, you got 4 practices, you have this, you wrote books, you did this, you did that. Yeah, but I'm a hard worker. Like I'm really a hard worker. Most people give up or quit, because things it gets too hard.
Exactly.
Right. And with me, it's like, no, I don't quit. It's not part of my vocabulary. If I do something, I won't quit till the end. Like I said, I'm going to write the books. And I'm going to write a trilogy for my Starks, trilogy. I'm not going to quit till I get to the 3rd book, which is the trilogy, Was it hard? Yeah, because I had to work. I had 4 practices. I was going through a divorce and I had to write and I had to submit things to the editor. and I'm up 3, 4 in the morning, and I have to be at work 8 in the morning. So I'm only getting 2, 3 hours of sleep, but I'm going to get it done. Okay. That's what successful people do. They don't make excuses, and excuses are valid reasons. Okay. I can say, you know what? I was up 2 in the morning. I got to be at work at 8. I had no sleep. I can't function, but nobody cares. Who cares? But you, right? The person you're working for, they don't care. That's an excuse to them.
As long as you show up and work.
Right. It's a valid reason.
You might get paid too.
Right. It's a valid reason. You had no sleep because of all this thing you're doing. But at the end of the day, you have a job and you have work to do. The person doesn't care because they're paying you a paycheck. So I'm the type of person, I don't make excuses. I just get stuff done no matter what. And I think that's the reason why I am where I am now. Even with YouTube, when I started YouTube, what I've noticed was a lot of the folks, when I started YouTube, a lot of the chiropractors I started YouTube with, we started at the same time. They probably now have 5,000 subscribers. Now I have 51,000 subscribers.
Oh.
Right? And part of the reason
I literally just subscribed. Wow. Go ahead.
Yeah, to keep it coming because you can us all like, what?
Yeah, and part of it is YouTube is a lot of work. That's the first thing. Most people think, oh, these people are making $40,000, $50,000 of YouTube. I want to get on YouTube and make the same. No. It doesn't work that way. You got to put in the work. Number one, is a lot of work. Number two, it's very discouraging because you'll do the video, you'll put it up, and then you only get 10 views, or you only get 1 subscriber. So most people say, you know what, this is not working out. Well, you have to be realistic. If something is not working out, then you let it go. Okay, that's fine. But me, I've never been a quitter. So I had to figure out, why am I only getting 10 views and this person's getting 1,000 views? Right. So I had to figure out what the analytics are. I had to watch videos. I had to do different things. I had to say, okay, well, if my thumbnail look a little better, more people will click on it. So I had to learn that, you see? So, and the other thing is content. You got to stay consistent. So where most chiropractors were uploading maybe 1 video a week, 2 videos a week, I was uploading 2 videos per day. That's a lot of work. That's a lot of editing. So when I started, I'm editing for 3 hours, 4 hours because I didn't really know the platform, the software I was using, and I'm doing it myself. So I will put up a video in the morning and I'll put up a video at 11 at night, and then I had to work the next morning. So I work 10 times harder than most people. That's why I have 50-some thousand subscribers and not 5,000, you see?
Right. In a short span of time too.
In a short span of time, right. So you got to put in the work. Otherwise, it just doesn't happen.
Wow. So all of us new content creators, y'all heard that. I mean, there's no excuses. It's none. I mean, I don't know about the 2 videos a day now. I mean,
yeah,
but
it's a lot. It's a lot. I've slowed down.
Less than 2 years though.
Yeah, I've slowed down a whole lot. Like right now, I think I've uploaded maybe like a video the past week because like I said, I'm getting my time back. I've invested into cryptocurrency and it's doing well for me. So I'm slowly just kind of let things go slowly.
I mean,
you want to educate us on the crypto?
Yeah. Actually, a friend of mine who is he's one of my partners in the other 3 clinics, and he got me involved in crypto. So I used to, do stocks, basically invest in stocks, and he had got me involved in something called Shiba Inu, which is a cryptocurrency. Okay. Now, once again, this is not investing. Shiba Inu is what it's called. Okay. It's a form of cryptocurrency. So like, you hear the Bitcoin and Ethereum. So Shiba Inu is another set of, tokens, set of coins.
So I'm thinking that's the one we just started too, but I couldn't, I thought it was a shorter name, but go ahead.
Right. So he got me involved and I invested, I think I started with about like $7,000. I just went in ahead and threw it in there, and it did well to do 6 figures with it, right? So now the next investment, so now I'm pulling out of that, and the next investment we're getting into is something called Saitama Inu, and I've done the research on it, and it's a solid token, it's a solid company, and I started actually investing in that probably like maybe 4 weeks ago, and I've already made 6 figures from that too, and it's predicted to actually, yeah.
We're like leaning in.
I'm like, wait, what?
Yeah, and basically those things, they 10x on you just very quickly. So I started out with 15,000. In about 4 weeks, it was 150,000. Now once again, yeah, he actually wrote it. Shiba Inu token, decentralized. Yeah, that's the one. But now Shiba, I've actually kind of pulled back from Shiba because it's starting to go down, and I'm investing more in Saitama Inu because I've done the research. It's more of a solid token. They have a lot in the pipeline. They have NFTs coming out. They have games that are about to come out. They're going to have partnerships with even like hospitals and trying to get their currency into it. So they're doing a lot. And, these type of investments, you go in there and within like a few months, your money just shoots up, So if it goes the way, if the momentum continues, hopefully by June of next year, I'll probably be retired.
Wow.
Yeah.
So you have all of this going on, and like you said, the main thing is you just didn't give up, and out of everything you accomplished, the most important thing is time. And that's something you cannot get that back. You getting the fruits of your labor now.
Right.
And you're finding all these different ways of getting the fruits of your labor, just basically almost for the fun of it at this point, because you are so set. But the most important thing is time. And that's what I'm realizing, just being cooped up in a pharmacy all day for 12 hours.
Yeah, absolutely.
Especially as a woman, when we get a certain age, we don't want to do all that.
Right. I understand. And then that's, like what you're doing now, starting your YouTube channel, look into investments. I always tell people the best form of success is making money in your sleep.
Right.
Like right now, this is my best form of this is my best business right now, my phone. I'm always there looking at my cryptocurrency, to see what the prices are. I'm always doing research. And this is not financial advice, it's just I'm telling you guys what I'm doing,
Right. Everything we say is just for informational purpose only. You have your own doctors, you have your own people. Do that. All right, go ahead.
And actually, the person actually wrote Saitama price, and that's the name of the coin. It's Saitama Inu. And basically, when you invest in these coins, you watch, your money will go up and down like stocks. But like I've had family members who invested like $3,000. Right now, they're at around like $90,000. And this was over a short period of time. It's passive income. You're sleeping and you're making money, But like any investments, you don't invest money that you have to invest money you can lose. So don't invest the mortgage, or your rent, it's just passive income.
Yeah. Right. Wow. Okay. So so you have a lot. So tell me about your books real quick, and we're gonna be wrapping it up because, like I said, you probably have dinner and stuff. But tell me what's up with your books? Where you get time to write books?
I wrote those books. Let me see.
Because I tried to do an ebook and that almost killed me. Writing that
ebook
killed me, and that was like a 20-page ebook.
Yeah, it's a lot of work. The first book I think was 400 pages or 300 some pages. It was a fiction novel. So I worked, got the clinics running. The first 2-3 years, extremely horrible. Lost a lot of money, a lot of sleep. And then after 3 years, things started to go well. I'm starting to make money, starting to be even. I think that was the point where I started the second clinic. Okay. And then the divorce happened, So that was, I don't wish that on my worst enemy,
Right.
It was emotionally draining. It's like you go to work and you have to fake like you're happy, but you're dying on the inside, Yeah. If any one of you guys ever been divorced, I don't know, but I'm just, that's how it feels. So,
a few times, yeah.
Right. So now, I had to find something to escape, everything that I was going through.
Okay.
And I've always, I love words. I love playing with words. So I decided to write, and then a friend of mine read what I was writing, like the manuscript. I wasn't planning on, publishing a book or anything like that. And he said, what, this is actually pretty good. This can actually do well,
Everything you do is awesome.
But it was easy because I was writing stuff that I was going through, that I was going through.
Okay.
It wasn't really hard. I was just putting stuff down, you know. I just made up a story about a CEO, you know, who was well known, you know, well liked, you know, rich, and you know, had some issues going on with the wife and got divorced and faced the man who the wife was cheating with, and then he ended up in jail and lost everything. And then the story went from jail until, you know, he got out. So
Right.
so that book was called When the Serpent Bites. That was the first book.
Okay.
So when the serpent bits you, this is what happens, you know, kind of, you know.
Right.
And that book actually did pretty well. We got like a gold medal from Reader's Favorite, and we made a lot of money. You know, I made a lot of money from it. And then I said, okay, well, shoot, the first one did well. Let me just continue to the second one. You know?
Okay. And
So we did the second one.
This is all while you're getting all your practices going.
Yeah, everything is going in the meanwhile, you know, practice and everything. And then the second one is it's all on Amazon. The second one is called When the Phoenix Rises.
Okay.
So then that went and got a award as well and did well. And then I wrote a third one, but this was years ago though, you know. And the third one did well. And then, you know, I kind of wrote a few books which didn't do that well, but the first three did really well. I did, you know, as far as the financial portion of it, I did well with that as well. And then those were the books. Yeah.
Okay. And I'm almost getting paranoid because I don't know about, because my daughter loved to read books. And I could have sworn I've seen those titles. I just let her read anything. But I'm gonna have to ask her about that.
Yeah. So if you go on Amazon and then you probably just type my name or type, there it is. Yep, she got it. When the Serpent Bites. Yep. That was
you gotta be over here looking for stuff. Yeah.
Yeah, that's and it also has an audio book as well.
For that. Yeah, I see that.
Yeah.
And did you do
I have a book club, so this might end up being part of it.
Yeah. I actually think it was a really good book, especially the first one, because it was all the stuff I was kind of going through, but exaggerated for the book, you know?
Right.
Like in the beginning, just like if you pull up the audio book, the first few minutes of it, that should get you right away, you know? So and that was that.
Along with scientific.
Say that again.
I'll say you're scientific, but also
what did you say, Tish?
I was saying he's creative and also scientific minded.
Oh yes, thank you. Thank you. But and that was that part. I did the books, and then after that I've been so busy with patients, you know, that I didn't write it, you know, anymore. And then now I'm into the crypto thing, and hopefully by next year, maybe I'll hire another chiropractor to take over, or maybe I'll probably just give the clinic away to the employees. So that was my gift that's what I'm thinking of doing. They don't know about it yet, but I
give it away.
Yeah,
not sell it.
Nah, I wouldn't sell it. I wouldn't
not own it. Let them work it.
I can't mess
it away.
I can't mess with him no more. He's doing too much. I can't. He just doing too much. He's one man. He just doing too much for one man. I can't.
If I do that well, like if everything goes well in, you know, the next 6 months to a year, you know, like these people, they were very loyal. Right. Yeah, they work really hard. You know, especially the physical therapist. He has been there with me for years, you know. So if it goes well, you know, anything can happen, especially with investments.
Right.
But the way they're predicting this stuff to go, okay, especially Saitama, if it goes well the next year or two, then I'll probably just give them the clinic. You know, it's already established. The patients are already coming. We see a lot of accident patients there too. So I can just say, hey, take my name off, write the legal papers, just take it away, and then that income, they can just use it for their family. You know, that's the goal. But, you know, we'll see if that happens.
And a big thing too is when you're much more prosperous in general as a person when you don't have a closed fist.
Absolutely.
When you're open-hearted and you don't have a closed fist and you have a gracious heart, that's when things just dump on you.
Absolutely.
You know? So obviously everything's going to blow up for you 20 times fold for you to have that kind of mindset. Because a lot of times when people are so not like you not giving it away, it would be selfish. Right. Because that's a very, very, very generous gift. I mean, it's just amazing. It's just too much for words. This is too much. And Trash Can Wave said the secret is out. Secret's
Yeah,
out.
it is out, but I don't think they're social media people, so they probably won't know until
Right.
and it's all if so far I've done well. Like I've done well. Like it's unfathomable the
Right.
amount of money I've made in such a short period of time with this type of investment. And if it continues, it's
Why not? Right.
why not? Yeah, like, and
Why
at
not
that
bless someone
point,
else?
yeah, I'd rather bless somebody with something else because I know, like, some people are not risk takers. They're not gonna. I can tell them about the investments. They're not gonna do it.
Right.
It's not them. They don't like to take risks. So if I'm doing that well, why not bless somebody else?
Okay. It's Crash Waves asks you, are you familiar with the 48 laws of power?
I've heard it, but I have not read that book. That's one of the books that I actually want to read.
What is your favorite book? Like when it comes to business and being a successful person and pushing ahead, what's your favorite book? What's your go-to book? Like some people like Rich Dad, Poor Dad, or when it comes to money and stuff like that.
That is a good book, Rich Dad Poor Dad. In that book, I've learned a lot from it. Even some of the decisions that I've made, as far as business is concerned. So I really like that book, but I think my favorite book is Life Experiences.
Oh, okay. True.
You live and you learn. I lost a lot of money from bad decisions, and I learned from it. Bad investments, I learned from it. So that's the best experience.
Right. But you kept going forward, and I mean that's the thing. If you keep pushing forward, it always works out.
Absolutely.
And just when you think, when you quit, that's when the breakthrough is on the other side. So whenever we feel like with us trying to get a YouTube channel going, or get it to be monetized, or if it's monetized and you want it to blow up, just be like, Kay remind me, and I remind you too. Just when we be like, we just don't have time for us, we quit, that's when it's gonna blow up. So just push to the other side. When you get that naggy feeling of I'm done, that's when you're about to get it done. So don't give up. I agree. The more you give, the more you get. It's true, at least for me. Yep, that is so true.
Definitely true.
Yeah, it is. And then things just, like you said, things just happen. They just happen. Like the other day, I had the people from ABC. They did like a little interview with me, and they're supposed to write an article, and I think it's supposed to be out in like
really
2 days. Yeah, like I think it goes on their little sister channel, like ABC, Fox, and all those places.
Right.
So it's like things just happen. Like I had the company reach out because they want their products, they want me to partner with them, and it's you get to a point where you have so much going on. It's like you're not being an asshole or anything. It's just your time is so precious that you're like, I don't want to deal with it. And I remember when I started my business, and I'd go to attorneys to introduce myself. So that's how I get, business. I say, hey, I'm Dr. Clerge, I have a business, blah, blah. And they'd be like, oh, I ain't got time for that. And I'm like, man, they're such ass. Like, why, now I understand, when your time is so precious and you have all these people trying to reach out and, but things happen. If you do good by people, good things will happen.
Right. And I appreciate you so much because like I always know, and as everyone is hearing now, I didn't know you had all the extra books and everything. This is blowing my mind. I mean, but I'm a small YouTuber, I'm just trying to do my thing or whatever. And you always been so gracious with me. You could have easily been like ignored my messages. First of all, you just could ignore them, but you never have. You always been very open, very gracious to help a sister out, and I appreciate that so much because you have a lot going on. You don't have to. I mean, because this is just almost a one-way street, but you never know. I might be the next Diana Ross. You never know.
Absolutely.
Okay.
You're so stupid. We say, Trasha Way says a page turner, and you can hear it in a lot of powerful people's actions. So I guess he's talking about the Power of 48 or that book.
Oh, the book. Yeah, I definitely need to get it and start reading because I've heard a lot about it. So I need to start reading it.
So any questions or anything, guys? Do you have any last questions or anything? Because it's been an hour 30. So I know, is it dinner time? That's what
I got up and cooked early.
Oh, okay.
Y'all have any questions in the chat or anything before we end tonight? But yeah, so what are your final thoughts, Dr. Clerge, for encouragement? I mean, you already said a mouthful, so I don't know what else you could possibly say. I just love the fact I really wanted people to see you, to hear you, because you're a Black man. You are definitely doing your thing, and then some, and you're not pretentious about it. As people can see, you have 50K subscribers. I have we have less than K, and I have less than 500. So you could have easily just pew, I don't have time for y'all, but you take the time, and that's just everything. So you have any let me see, hold on. Blind Guy, his wife, their life says, and they're doing their thing. Their show is thebomb.com. And it's very clean, streamlined. It's not off the rails like we get sometimes. But question is there a reason Dr. Clark doesn't have his books linked to his YouTube channel? I don't see them on his about page. Does he prefer to keep his industry separate? Oh, that's a good question. Yeah. Do you keep everything separated, or how does
yeah, I tend to keep it separate because the books, I wrote them like a few years ago. And I made a lot of money with the books, and I don't write anymore. I just don't have the time, so I didn't link them because most people, like some of the books, I'm actually supposed to write a second book, for one of my series, and I just didn't have the time. So I decided to focus on patient care. So that's the reason why I didn't really link them. But, if most people, what happens, like after, like some of my patients, they'll go on Google and just type my name in. So when you type my name in, everything comes up, like my books will come up, my YouTube will come up, Instagram will come up. So most people, when they Google my name, like everything will just pop up. So, and I've had patients, they're like, oh, you, is that you? We were books, so
exactly.
That's why I don't really link them, because once you search my name, it'll show up anyway.
Right. And Trash Can Always say he's a cool dude. Subscribe to your YouTube channel. Yeah, check it out. It's pretty. If you want a lot of cracking and just links I've never seen, like the Y strap. Obviously I didn't learn that much since I was calling it a trapeze strap. But yeah, it's a really good channel. It's really good. And whenever I should need any kind of back ailments or whatever, I definitely know to do a chiropractor. I never really thought about it. But I always say, if I go, I won't come to you. Yeah, I mean, heck, how far? Like 6 hours away, Kay, from DC?
6 hours.
Yeah, 6 hours. So
wow, you guys are far. You're like some of my patients. Well,
5:30 if I'm driving.
5.5 hours if you're driving.
5:30. Any last words, anything? But yeah, we appreciate you. This has been really good, and it's really inspiring. Like I said to all us old new YouTubers, let's stick with it. That we got to stick with it. We're not doing this for nothing.
Right.
We're doing this to get from one place in life to another, and it can happen. I mean, like he said, he done 2 videos a day. But we can still do it with 2 a week. Depends on how fast we want to grow, but the main thing is to stay consistent. Consistency is everything.
Absolutely.
Yeah. So any last words or anything before we let you go? We just want to thank you so much. But any last words or anything?
I would say, is just stay consistent, like you just stated. Resilience is the word I'm looking for, because I think a lot of times people just want overnight success.
Yes.
And if it was easy, everybody will do it.
That's true.
That's what I always tell myself.
It's easy to get, it's easy to lose.
Right, absolutely. But then what you have to also think about is, if person A can do it, you can do it as well.
That is true.
So that's always been my motto, even when I started YouTube, and I'm like, well, if this guy can do it, well, I can do it as well. And then, when I made my first $1.20, I said, well, I made $1.20, so I could make $10,
Right.
And I made $10. So I said, okay, if I made 10, I could make 100. So I made 100. I said, if I make 100, I can make 1,000. And then, when I made, like, the highest I've made in a month was about 10,000. And I said, well, I could make 100,000, but then I got into crypto, and then that kind of kind of evaporated, because the money is more in crypto than it is YouTube. But just be resilient and don't give up. people just focus on this overnight success, and it doesn't really happen. You may get lucky and it happens, but you just gotta stay consistent.
Yeah. I mean, hopefully from his channel, y'all will see that y'all always, I mean, and the thing is too, you have a family. It's not like you're I hate to say, a lot of accomplished men in our communities, they just don't want to get married or, but you value family. And with family, where it comes from, that legacy, men, because I want a fourth husband one day. No, I throw that in there. So,
yeah,
I mean,
so
if you don't have family, you don't have legacy, and that's something that you have always understood. And so it's not like you're just doing this and you're just chilling. You have like children to look after. You have a beautiful wife that you take care of, and y'all take care of each other. Y'all have a legacy, and that's what it's all about. So don't see him as this guy who's just pushing his agenda forward and is doing it for him. No, he's doing it for the legacy. He's doing everything for the community. He has himself in a position where he can take care of his people. He just can give it to them and start them with their own legacy. I mean, so see it as for everything what it is and be inspired. And I hope I know that's what we accomplished today. So I appreciate you, Dr. Clerge. Okay, you have any last remarks or anything, hon?
No, I think he wrapped it up pretty good.
Did he not, honey?
He did that.
And thank your family for letting us, share your
Borrow
time.
you.
I was going to say that, but share. Oh, we have the lead attorney. He's that's the attorney I mentioned to you earlier. He has his own. He has YouTube University. And he really inspires all of us YouTubers. He's saying, lead attorney, do you have any questions for
so lead attorney not gonna speak to me? Okay, then. All right. I see how you do me. Go ahead. Carry on.
He's speaking around. But yeah, the lead attorney, he also big into inspiration and is letting us, know not to quit. So that's why I just enjoy. This is so great to have all these beautiful Black people just doing our thing. But you're Haitian, right?
I'm Haitian. Yep. I'm Haitian.
Yeah, so I know it's that twang. I hear that twang in your accent. So
accent is definitely there. Yep.
Mine is too, but I'm just from South Carolina, so I can't help it. So I didn't want to call you out.
He said he didn't want to call me succulent.
I mean, that's your name. I mean, what else would it be?
K. How about that one? K, yes.
Okay, succulents. But anyway, so I appreciate everyone, and y'all take care. Thank you, Dr. Clerge. Take care. Bye-bye.
Thank you.
Bye.
And we look forward to seeing you on ABC News, right?
Well, it's an article they wrote about me, so I'm sure it'll pop up on Google maybe in a few days or so.
Right, and check out his books. And what are your books again, you said?
Well, it's a Starks trilogy, so basically 3 books, and then I have some other fiction books that I wrote as well. They're all on Amazon, so anybody's interested, go check them out.
All right, y'all take care. Bye-bye.
Bye. Bye.